Okay guys, I just left Dr. Bassiri's office on the Upper East Side and I just got a mini nose job.
My name is Dr. Michael Bassiri Tehrani. I'm a board-certified facial plastic surgeon on the Upper East Side of Manhattan. My training is ENT head and neck surgery, so all the delicate, complex anatomy of the face. Within that, facial plastic surgery is a subspecialty. Results are very visible and can make very meaningful changes in people's lives right away. For me, it's very important to understand why a patient is coming in, what motivates them to make the changes, what changes they want, and if they're not sure about the changes they want, really taking the time to show them on digital imaging so that they can better articulate, even for themselves, what it is that's bothering them. I think a big mistake would be focusing on things or making changes that aren't bothering people and kind of injecting your own vision onto a patient. It needs to come from the patient. Communication is a big part of this. Something I wish more people understood is that you don't have to leave with like an operated look that people know you had something done. I think that the bad results in plastic surgery get all of the press and attention and negative press, and can spook a lot of people from maybe seeking out the changes that would make them happy. The tip stitch rhinoplasty or tip stitch is something that is a term that I kind of came up with. It is one part of a regular rhinoplasty that over the years I have adapted to doing without really any major incisions and awake in the office. It started with some of my own patients who just were either too scared to do anesthesia or didn't want to go back and do a small revision, and it worked very well. There are a lot of patients I've noticed who are otherwise too nervous to even begin the conversation of a surgery, who just knowing that there might be something else makes them feel comfortable enough to come in and have that initial discussion. It's a step up from maybe putting fillers in the nose. I think it is overall a very safe procedure, and unlike fillers, which have some kind of scary complications, this is a nice way to get a change without some of those risks. My goal is to be there for the patient and to get them to a result that will make them feel more comfortable in themselves and make them feel more confident and maybe feel a little happier when they look at themselves in the mirror. You can sometimes see the way the patient carries themselves after the surgery changes, and they can look a lot more comfortable, confident, maybe a little more outspoken. And these things all, to me, are like a huge success. First thing I'll do is just ask some basic medical questions, examine the nose, take some photographs, and then into this more comfortable room where we can discuss what they might be bothered with. Once you go in for the consultation, it's very important to know, is this someone I can communicate with? Do I feel comfortable with this person? Does something feel off? If it does, that's not a great sign. This is it's a surgery, like I said, not a haircut. So you want to make sure you feel good about the person doing it. It's a relationship in the sense that after the surgery, there is follow-up that goes on for a year plus afterwards. You really want to feel like that person is taking the time from the beginning to understand what you're trying to do for them.